Laser eye surgery corrects your vision by reshaping the front of the cornea to the perfect optical shape to focus an image on the retina. If you're having LASIK done, that involves two stages. One is to make a very thin flap in the cornea, which is done by a specific laser called the intralase. And the other stage of that procedure is the correction of the vision, or the reshaping of the eye to focus the image. And that's done by an excimer laser, dependent on the make of the laser. So the patient coming in to have their surgery done will lie down on a bed, and the bed typically moves between these two lasers. The patient doesn't move themselves. They're lying down looking up. The first stage will be to create the flap, and the flap is about 1/10 of a millimeter thick, so it's incredibly precise. And the laser takes about 12 to 13 seconds to do that. So during the flap making stage, it's very important for the patient to stay still. But the eye is fixated or kept still with a little ring that's applied to the surface of the eye. The patient has local anesthetic drops, so they can't really feel any of this going on, although they'll be able to see a bright light flashing. Once the flap's made, we usually move the patient to the second laser, and in LASIK you lift the flap up gently, and then the laser will track onto the eye, and once everything's in position, the treatment starts. Again, the actual laser component of the treatment is incredibly quick. Modern lasers like the Schwind laser can correct a diopter of short sight within about 1.5 seconds. Okay, so most treatments are over in less than 20 seconds. And then the flap is replaced, a contact lens is placed over the eye to protect the flap, and then the patient's seen the next day. It's incredibly quick. Most patients feel slightly anxious during this, and then there's this sense of elation once it's over that they can see well, and it takes about 10 minutes per eye to do the procedure, get everything in place. But the actual laser component is just seconds.